In this video, I'm going to demonstrate how I work around elbow joint. This person, he had radial fracture like 8 months ago before I filmed this video. So I will mainly work on his elbow joint, but since he had surgery on the forearm and elbow, his body system is a little bit messed up. So I will focus on the shoulder area, elbow area, and maybe lymphatic drainage. I will work so many tissues today. The first thing first, I'm going to drain his lymph. I drain lymph around clavicle. Next, the lymph around axilla. And upper arm. Oh yeah, I forgot to ask him how he's feeling around elbow. So I wanna have a comment before the treatment.
体内でもう40度ぐらい詰まってて
So his pronation is like around 45 degrees. He feels restriction about 45 degrees here.
海外も、90度まで行こうと思ったら手首の方までなんか詰まりが出てくる。
So he said when he tries to supinate is palm up, he can force to go to 90 degrees, but if he does it, he feels tightness around wrist joint. So this is before the treatment, and he also has a flexion restriction and extension restriction on elbow. So I will move to his elbow joint. You see scar tissue? This is scar tissue from surgery. Yeah, he got a bad fracture on the radius. Let's check his extension. It's not the full range of motion. In normal position, he could go a little bit more, like few degrees, several degrees. This is extension before treatment. And this is flexion before treatment. I feel tension around here, or stuckness around here. Flexion, extension, pronation, I feel tension around here. And supination, yeah, as he said, I feel tension around wrist joint. So I will drain lymph. Now I will check his elasticity of interosseous membrane. Interosseous membrane is a kind of a thin sheet in between the two bones on the forearm. Radius, ulna, and there is a membrane in between two bones. So I'm checking his interosseous membrane. Yeah, he is tight here, the distal part of forearm. Go to the touch. で、こうと頭頂。で、ニューラルクレスお願いします。逆側の。そこでお願いします。上の方の。はい。Nice. Let's check resistance. Nice. It's very nice. Pronation? Yeah, it's much better. It's already good. Supination. Yeah, tension around wrist is better. He still has restriction here, but it's much better. Like I feel 50% improvement. Let's see, flexion. Better. I feel tension around here, biceps or anterior part of elbow. Yeah, extension is good. Let's see what I do. I'm going to work the joint between humerus and radius. The humerus is upper arm bone. Radius is outside part of the bone. There's joint here. He told me since he got injury and he feels his body is disorganized. The surgery or big fracture or big injury can give big impact for whole body. Now I focus the joint between radius and ulna. I just worked on joint between humerus radius. Next, in between radius ulna. Good. Now I will work ligament around radial head. The ligament surrounds the radius like this. Yeah, that's it. 個人体そこで Nice. Elbow flexion. Extension. Extension is very good. Pronation, supination. Now I work on wrist joint. I do myofascial release on biceps brachii. I feel the pulse is increasing. Maybe because it's from this technique or reaction from this technique. I don't know, but I think this is good sign. Elbow flexion. Good. Less tension. Extension, very nice. A little bit more work here. Good. The next one, the joint between ulna and humerus. I worked on two joints in between humerus, radius, radius, ulna, now humerus, ulna. Very nice, it's changing very, very well. Nice. Extension, very nice. Flexion, it's nice. Nice. Now let's check range of motion. Flexion, very nice. Extension, yeah, extension is much better. Pronation, supination, a little bit around here. Nice. Supination, very good. Pronation is good. Flexion is good. Extension is the biggest change. I mean, extension got biggest change. どうですか？
やってもらう前は屈曲したらここ詰まってましたけど、それがなくなって今はどっちかというと後ろ側が制限感じるようになったっていう。
So what he said was that before the treatment, when he flexed elbow, he had tension or stuckness here, but it's gone. Because his stuckness is gone, now he feels tension around triceps brachii. I may work on the triceps a little bit. My right fingers under triceps brachii. Maybe, you know what? Sorry, it's hard to see, but this is a technique I use. Nice, very, very nice. Action. I don't feel tension. Let's ask him. 今の。
さっきより良くなった感じします。こっちのとこ。
So he said his tension around triceps is gone. Was over. 全体的。
オーバー。
全体的に。
さっき海外した時も言ってたこの手首の詰まりもなくなって
Do you remember he said when he tries to supinate the wrist, he had tension around here, but he says it's gone.
海外に関してはなんかまた可動域も良くなって違う場所にまたテンションというか次の制限感じるようになってきたから
When he does pronation, he feels the tension at a different point, not around elbow joint. Let's see. It's backside of the hand, I think. This place. Maybe he had a fracture here, so he had difficulties using hands or fingers. Maybe that's why he's feeling tension from different place. Maybe. Okay.
わかりました。
So he feels much better. So the manual therapy can help the dysfunction after surgery. Yes, surgery works to fix fracture or dislocation or such a thing like orthopedic injury. But surgery or scar tissue can give a lot of fatigue or damage for the body. So manual therapy can treat after the surgery. So this is a good choice to recover the injury. So that was today's video. And by the way, this is my friend. He does kind of same kind of treatments like I do, and he is good at helping children's development, and he is a physiotherapist as well. So he can do many things I cannot do. I put his Instagram account. If you are interested on him, please follow his Instagram account and do not forget to subscribe my channel, of course. See you in next video.